So I'm going to show you how to use the otoscope and the ophthalmoscope, all right? So this is a speculum, so you want to make sure you put it on the otoscope and that it does not come off. And then this green button you're going to push down and twist, and that should make the light come off. Come on. So I hold the otoscope upside down, and then I'm going to put Mr. Tong's head like that a little bit. And then I'm going to pull up and back for adult. Okay, remember for a 3-year-old and less, it's going to be straight down. But for an adult, it's going to be pull up and back. And so I'm going to look inside his ear. Okay. And then what you're looking at is you're going to say about the tympanic membrane, whether or not it's pearly, gray, translucent. And then if I'm looking at the right ear, the cone of light should be at the 5 o'clock. If you're looking at the left ear, it should be at 7 o'clock. Okay? You shouldn't see any redness, any bulging, etc. If sometimes you might see a lot of cerumen, okay, but you should say what you would normally see with your patients, okay, for the final practicum. Obviously, you would say what you see on a real-life patient, okay. All right, so that's the ear. Now I'm going to switch out the head, and I'm going to show you how to check the red reflex, okay? So that's all you have to do for the red reflex, meaning we're not looking inside the eye and at the optic disc and the macula, those kind of things. We want you to see the red reflex, which is light illuminating off the retina, okay? So I'm going to go at like a 15-degree angle, all right? And I can already see the red reflex, and that's all you have to do. If you were going to go inside and see the eye, you would follow the red reflex, and you would move the diopter around, and then if you went further in, then you can follow the arteries and veins to the optic disc and then to the macula, okay? But we're not doing that. You're just doing the red reflex, all right? So I just wanted you to see how you would position. Really, it's supposed to be right eye to right eye. I can't close one of my eyes, so I do the best I can to look inside the eye. But again, you are only looking for the red reflex on the patient. Thank you, Mr. Tong.
You're welcome, Dr. Tong.